My name is Dr. Chris Piller of the Harbin Clinic Orthopedic Department here in Rome. I've been with the clinic for 7 years now, and we offer a variety of services at the Harbin Clinic Orthopedic Department, including non-operative management of musculoskeletal injuries or surgical management of conditions and injuries as well. We offer everything from fracture care to managing sprains and strains to surgical management of conditions and injuries. My practice focuses primarily on minimally invasive surgical techniques using arthroscopic surgery of primarily the shoulder and knee. I also do reconstructive surgery such as joint replacements for arthritis or trauma and fracture care. One of the questions I'm often asked that's a common concern for patients is whether there are options other than surgery for treating orthopedic conditions, and the answer is definitely yes. Most of the patients that come to our office don't even enter into discussion of surgery. There are many different options to managing these problems and conditions that involve non-operative management, from medications to physical therapy prescriptions, braces, and even injections. These are procedures that can often be done in the office and give fairly quick pain relief without having to consider surgical treatment. One example of this could be the treatment of tendonitis of the rotator cuff in the shoulder. That's a common condition that can occur from overuse injuries or sporting injuries. It involves inflammation in the muscles that surround the ball and socket joint of the shoulder. Those patients often respond very nicely to non-operative management that involves anti-inflammatory medications, physical therapy modalities for strengthening, and injections of corticosteroid in the joint to relieve inflammation and pain. Another example that's very common is arthritis pain in the knee. We're seeing this more commonly as the population gets older and as people remain active. Everybody knows about surgical treatments for arthritis such as knee replacement, but there are a whole litany of options that do not involve surgery. These again include the use of medications such as Tylenol and anti-inflammatories, physical therapy modalities, and bracing, but there's also different types of injection therapies for arthritis other than the corticosteroid injections. One example of that is a process called viscosupplementation injection, which is essentially a lubricating shot. This is not a medication, but actually is considered a device and is very effective in relieving pain and restoring function in the joint. This again is an office-based procedure that's done under local anesthetic and often gives many months of relief in order to avoid having to have surgery. My team at Harbin Clinic in the sports medicine division has been privileged to be the official providers of health care for a lot of the local teams, including high school teams, both colleges and universities in the area, and some of the professional athletes, including our minor league baseball team and some of the football programs in the area. This is a special area of interest to me, and we have a lot of options that we can offer these patients to treat common conditions. One of the most common conditions that we see with our young athletes is a knee injury called an anterior cruciate ligament tear. It's very common, and it's becoming more common, especially in women. My team at Harbin Clinic Orthopedics and Sports Medicine has kept up on all the latest advances in the treatment and prevention of ACL injuries. We offer non-operative management, including physical therapy and bracing, as well as surgical reconstruction of the ligament with minimally invasive techniques and advanced rapid rehabilitation.